I would enter the patient's room and introduce myself. Hi, my name is Michaela Kicklager. I'm a student nurse at the USA College of Nursing, and I'm going to be performing a soap and suds enema today. So I would check my orders to see that I would be doing a soap and suds enema on arrival to the floor. I would also check my two patient identifiers, Jaguar Jones, and I would check the medical record number 417-6352, 417-6352. I would also see that the patient has an allergy to penicillin and it matches his chart that he's allergic to penicillin. I would check my hospital policies. I would come over here, perform hand hygiene, put on my goggles. I would gather all my equipment, perform hand hygiene, put on my goggles, and then put on my gloves. I would be sure that I had an IV pole to hang the enema bag on and also a bedpan for after the procedure is finished. I would then place down my waterproof barrier to protect the bedding from being soiled. I would now be sure that my tubing is clamped, and I would add warm water to my enema bag. I would add 750 milliliters to 1,000 milliliters. I would then put in my Castile soap. And gently agitate the solution to mix it. I would then unclamp and prime my tubing and then be sure to reclamp the tubing. And I would place my bag either on the IV pole or place it down on a hard surface, but just not putting it on the bed, on the patient's bed. I would then come back to the patient and I would raise the bed to working height. I would lower the side rail and I would place the patient in left lateral sims. I would then come and I would lubricate my tubing. I would grab it with my dominant hand and lubricate my tubing, and then I would place my non-dominant hand on the patient's hip and instruct him or her to breathe, take slow deep breaths during the procedure. And if my patient had hemorrhoids, I would instruct them to bear down during the procedure. So then I would take my non-dominant hand, I would spread the buttocks, and then I would spread the buttocks with my non-dominant hand and insert the tubing 3 to 4 inches. And then I would unclamp the tubing and hold the enema bag 18 inches above the patient's buttocks. And I would stop if the patient experienced any cramping or any kind of tenderness, I would lower the bag for the patient's comfort. And then after the procedure, I would clamp the tubing, and I would pull the tube out. And then I would instruct the patient to hold it in for 10 to 15 seconds, and I would place the patient comfortably on a bedpan. I would place this end of the bedpan towards the patient's buttocks and this end of the bedpan towards the patient's thighs. And then for this bedpan, I would place this part of the bedpan towards the patient's buttocks and this portion towards the thighs. And so I place the patient onto the bedpan and provide them with some privacy and let them expel anything that they needed to. And then I would go and I would document the amount and the type of enema that I'd administered. I would document the time that it was administered. I would document how the patient handled the enema, and I would document the color and amount of return that the patient had, and I would also document how I left the patient.